Hi, I'm Cass, and these are my bones. Today we're going to start our anatomy, and I thought even more fitting for Halloween arriving in a couple weeks, I thought I'd show you my bones, because you have some too. Don't worry, you do. So, um, let's talk about bones, bone structure. It's the thing that we really can't see because, we're always involved with our skin, how our face looks, the muscles, the strength of our muscles, how flabby we are, how fit we are. But we forget about the awesome bones. Well, bones are here. It's the structural system of your body, and it's made to support us. We're going to be using this wonderful book by Ray Long, who is an orthopedic surgeon, one of my favorite books, anatomy books of yoga, called The Key Muscles of Yoga, and there's a volume 1 and volume 2. I invite you to get the second edition because it's a great viewing of postures and how they work in the muscular system of yoga. Which ones fire, which ones don't fire if you're using passive and also active tension. So yes, get both volumes. You will not be disappointed. So let's start with the book. One of my favorite things about this book is how he in-depth and simplifies anatomy. Let's first go over the locations of structures on the body. So medial, these are terms like medial, distal, posterior, dorsal, and deep. So medial refers to closer to the midline of the body. And a lot of times, like people say, I have something going on with the medial edge of my patella or my knee. And you know that they're talking about the inside of their body. Proximal, closer to the trunk or the midline. Like I have a belly button located to the proximal edge of my torso. Superior is above or toward the head. Anterior is toward the front of the body. Ventral is on the front of the body. And superficial is on the skin. Superficial, I have a superficial tendency when I get goosebumps, right? You feel the superficial goosing and the creeping of the skin. Lateral is away from the midline. So medial toward the midline, lateral away from the midline. You can think of the lateral quadricep and how the lateral portion of the femur and the outer edge of the leg, which refers to as the IT band, right? The TFL and the IT bands. And then we have distal, going away from the trunk and away from the midline. Inferior is below or away from the head. So superior is above or toward the head, and inferior is going away from the head. Like the foot is located inferiorly to the shoulder, but the clavicle is located superiorly from the elbow. Anterior, toward the front of the body. So anything on the front, if you were to get like a slicer and slice this in half, the anterior portion is like what we're doing. And the posterior part is the backside, right? Ventral on the front of the body, dorsal on the back of the body. And superficial is on the towards the skin, and deep is inside the body. So wonderful. We're going to be on page 10 in the book of The Living Skeleton. Bone is the dynamic living tissue that forms the body's structural framework. Bone mass is composed of organic and inorganic materials, including calcium salts and connective tissue, as well as cells and blood vessels within a calcium matrix. This combination gives bones a tensile strength that strength near that of steel, yet it maintains a modicum of elasticity. By aligning the direction of the force of gravity along the major axis of the bones, we can access the strength in yoga poses. And I love that line. Regular practice of yoga is beneficial for your bones because healthy stresses are applied in a variety of unusual directions. This strengthens bones, which remodel in response to stress by depositing layers of calcium into the bone matrix. Like a physiological yin-yang, lack of healthy stress on bones weakens them. So that right there, the weight of the pushing and the body weight resistance that we apply during all yoga, especially any kind of weight-bearing exercise, builds and deposits calcium on the bones. And it's easy to think of your bones as this inorganic, this is the skeleton's actually the decomposing or the decaying part of the healthy body. But when it's living, it has all these beautiful blood vessels inside. It can be strengthened, which is amazing. It can be wonderfully supplied to and create growth. So as we age, we can get stronger bones. It's not impossible by giving the body its healthy things that make it function great. In Chinese medicine, the bones are also known as kidneys, as the kidney essence. It's the thing that you're born with. So the strength of your bones, the nurturing of your kidneys. And we take that as an applicable principle when we think about Chinese medicine. So kidney yin can be cultivated through many different things, but one of them is, applying a slow walking distance through your legs as you maintain bone mass and you're building bone mass. The walking and just the constant movement of the legs. It can be a slow walk or a fast walk, depending on how you like your cardio and your heart to be toned. But just know that you're also building your kidneys, which in turn helps build your bone strength. Bones are also the body's reservoir for calcium, critical in a variety of functions, including muscle contraction. The concentration of calcium in the body is tightly regulated through a complex interplay between the skeletal, endocrine, excretory systems. This involves feedback loops between the parathyroid gland, the kidneys, the intestines, the skin, the liver, and the bones. So as women age and women approach menopause, perimenopause, the estrogen component is so very vital to the healthy state of bones, brain matter, and just of healthy aging. So if you're interested in that, I have some podcasts available to you after. Bone mass decreases in osteoporosis. This age-related decrease is associated with the loss of estrogen in postmenopausal women. Studies have demonstrated that resistance exercise maintains bone mass. Accordingly, it is reasonable to conclude that the various healthy stresses that yoga practice applies across the bones may aid in preventing osteoporosis. And also we encourage weightlifting as well and resistance training with bands. There are some postures that definitely yoga builds strength and muscle capacity and bone strength, but also weights and bands and resistance training do the fill-in part that yoga might not be providing for you, like bicep strength. Yoga has a way of really developing healthy deltoids and triceps, but the biceps might need a little bit more strengthening from band work or weights. It's a fast building muscle with two heads, and we can talk about that later, but just know that that is also an option. Bones, the bones of the skeleton link together at the joints and act as leverage for the muscles that cross the joints. Consciously contracting and relaxing these skeletal muscles move the body into various yoga poses. So bones are so great because the shape of the bones reflects its function. And there are 4 to 5 different bones that tell you that. Long bones provide a leverage. And we think about the long bone as like a femur, right? The femurs are a long bone. The humerus is a long bone. Flat bones provide protection and a place for broad muscles to attach. And we think of flat bones as the ilium, right? The sacrum. The short bones provide the weight-bearing functions. And the short bones would be located, you can see a nice insert, the viewing of my spine right here, right? The short bones and how they stack on one another. We have the cervical, and then that big bone at C7, it moves down to the thoracic, so all 12 of them, and then it starts the lumbar into the spilling of the sacrum in the back, right? Yoga accesses each bone's particular potential, using the long bones to leverage the body deeper into poses, the flat bones and their accompanying core muscles, right? All the abdominal muscles attach on the flat bones right here, as we will explore later, the various muscles of the obliques, the awesome abdominals, the tiny abdominals, the interweaving of the core muscles. And for stability, so the flat bones are for stability, and the short vertebral bodies are to bear weight. Gravity and the skeleton. We are on page 12 if you're following along. The Sanskrit word for yoga pose is asana. Sanskrit scholars variously translate this word to mean a comfortable or effortless position. Yoga postures approach the effortlessness when we align the long axis of the bones with the direction of gravity. This decreases the muscular force needed to maintain our posture. For example, in Uttanasana, the forward bend, the force of gravity aligns with the long axis of the femur and the tibia bones. Similarly, in Siddhasana, easy sitting pose, the force of gravity aligns with the long axis of the spine. Using muscular force to bring the bones into a position where they carry the load. Once the positions are attained, muscular force is no longer needed or no longer necessary or greatly decreased, right? So let's go through the bones before we talk about the muscles. First and foremost, if you see up here, my neck is a little crooked, but I think we have a clavicle up here. It attaches, and you can actually find it on yourself. You can follow your throat to the hollow and then trace those either pronounced or not that pronounced bones as they hold underneath the first rib. And then we have the scapula, right? It's the wing of the shoulder, this wonderful bone right here. It does a lot of things like protract and rotate the humerus on the back, and also pulls the ribs in kind of in an open space and a pronounced space and like a decreased space. So tension in the scapula can affect your breathing. Then we have the sternum. This is right here. The humerus is next. It's the upper arm bone, right? It's for the bicep. And then we have the radius, which is on the thumb side, and the ulna, which is on the pinky finger side. And my anatomy teacher always said, don't pick your finger with your ulna, right? The ilium is the sacrum, right? So if you're a mom, you know how the ilium kind of opens and stretches and allows the baby to leave the body once it's ready. You can also think about the hip bones as being the ilium, right? It is the top part, and the front is called the PSIS, and the back part is the SI joint. So sacrum, ilium, the back and the front holds kind of like where the hip flexors would be. The pubis bone is the bottom of the sacrum. The femur, the long femurs, right? I love this. You can see the femurs. It takes a lot to crack a femur because they're very, very, very strong. And then we have the patella, our little kneecap, which is actually, when you're born, you have a very soft patella, and it's the crawling of a baby that helps form and kind of calcify the patellas. And the fibula and the tibia, located on the lower half of the legs. So if you kind of run through that, it's on page 13, the skeleton setup. We will have a quiz on all of our bones and where they're located. And we're going to keep going into the fingers. We have the phalanges, which are the fingers, right? The metacarpals are where it's the meaty part of the hands, right? And just like in the foot, In the hand, it's metacarpals. In the foot, it would be metatarsals, right? Metacarpals, metatarsals. Carpals are the wrist bones. The radius, again, is in the thumb side, and the ulna is the pinky finger, picking your nose with your ulna, right? The radial head is where it meets the trochlea, the lateral epicondyle, medial epicondyle, which is all like around the elbow, and olecranon is the elbow tip. Now we look at the knee, the lateral condyle and the medial condyle. Lateral condyle, remember, is away from the midline. So lateral condyle is kind of like where the joints come together and where they meet. So you can follow your hand too, and just ride up the length of the lower leg to the crease of the knee, and you'll hit the lateral condyle, and the medial condyle is on the inside, right? Kind of just feel around. You can be soft and just feel the ridges of the knee. And it's a very sensitive area in Chinese medicine. The joints and the places are known as the earth element, is the place where all the nutrients are stored. And it's a great place to access like the power of that meridian. So just know that it has a lot of blood at those points, like the blood passageways behind the knee, inside the leg. There's a lot of femoral arteries, major blood points, and also in Chinese medicine we have the liver, the spleen, running all the way up into the pelvis. So you can access a lot of the pelvic energy through the knees, or just being aware of the knees. And think about it as you travel from the knee to the hip, right? You have these beautiful passageways. The muscles are like a transport system. If we keep them healthy, stretched, massaged, and open, we can help that intersection become more freer, right? In the same way with the bones. Like if we feel the bones and their movement, and just note, like if they're gristly, if it feels pain, if you feel pain, like there might be an obstruction there, or maybe something to work with, and maybe something to kind of keep an eye on as you get older. It might be a form of just something going on, right? So I love CBD in my practice. I use a cream of CBD. Heat is always great. Sauna, hot bath, magnesium salts, all those aid in the release of tension, and maybe like some calcification, arthritic tendencies toward the joint spaces, right? All right, the patella, the kneecap, the tibial plateau, and the fibular head. And we also have the tibial tuberosity. So kind of giving a look at what we call the area of the stomach and spleen right here. I will not test you on the condyles, but it's just kind of good to know, like at the joints spaces is where a lot of the intersection, again, of the bloods meet. There's a lot of potential to like create an opening in the body with the musculature. And so, massaging the legs are so beneficial, right? Even just a light circular movement, especially if you're doing some sort of lymph, if you feel swollenness, if you feel heaviness, it moves the tissue, and then eventually the bones get moved, right? The lymph gets moved. All these things get moved when a massage is applied, or gentle yoga. And then we have the ankle. Let's talk about the ankle. We have the hind foot, which is the calcaneus, and the talus, right? The heel, the ankle bone. Ooh, don't look at my dirty feet. We have the midfoot holding the tarsals, and the forefoot, which is the front of the foot, right? The metatarsals and the phalanges, right? And in yoga, I always love to put this right here. We always use different foot positions. We have the Barbie doll foot, right? It's kind of the pointed foot. Maybe she was she was the pointed foot. So Barbie doll foot. And then we have the flexed foot. And then we have somewhere in between, we bring the big toes forward, right? It's kind of like a pigeon toe walk, right? And then we have the other one where the pinky toe side of the foot reaches up. And just notice when you do the different foot flexions, where the muscular line goes into the legs, right? Does the little toe, how does it feel in reference to your outer hip? Look, we have the femur, right? Making a movement with the foot actually creates an effect on the hip, which is kind of cool. So again, we'll do the pointed Barbie toe foot, the flex foot, which I like to use on any kind of inversion as it draws the feet together and creates this midline. We have the pinky toe edge coming toward you, which you might use for just to kind of get an alignment of the feet as you're sitting in mountain pose. And then we have moving through the big toe mound of the foot, right? Like drawing an awareness to the inner thigh and the upper zipper. Going up to the base of the pelvis. So as we continue on with the shoulders and hips and the shoulders are ball and socket joints. The former flex function. In that deep socket, the acetabulum, the hip is designed to support weight, while the shallow socket, the glenoid of the shoulder, is designed to provide the maximum range of motion for the arms. Yoga postures balance mobility and stability by increasing the range of motion of the hips and stabilizing the shoulders. So in essence, all the ball and the socket joints are made to have a 360-degree movement, and it is our muscles, our connective tissue that hinder its movement, right? So maybe like to do an external rotation of the shoulder, you feel a pinch right here, or maybe you can't raise your arm up overhead. It's probably a muscular supportive or connective tissue thing that's in limiting its movement. But that's where yoga comes into play. It's wonderfulness to help move into that area and allow grace, right? It's the God-given gift of aging and moving gracefully into age. So, and if you look at the hip, it talks about the acetabulum. That's where the femur, right here. If you can see this great picture of the ilium, and then how the femur sits in the ilium, and that's the acetabulum, is where it sticks in, right? The femoral head, the femur femoral, right? It's the head of the femur as it goes in there. The greater trochanter is the ridge right above that. So we have the femoral head as it sticks in there. Greater trochanter is right on top. And the lesser trochanter is just the bottom edge of that same, just the kind of bone ridge, right? And the ischial tuberosity, which I'm not sure if you can see. I'm going to turn around to the back. You can see my sits bones, right? These are the ischial tuberosity, very prevalent. Boop, boop. It's the sits bones, right? It's the place in yoga where you can't scoot forward. It's ground you in your bones. So let's go back to the shoulder and the hip. We have finished that. As we move on to the axial and the appendicular skeleton, the axial skeleton consists of the spinal column, the cranium, and the rib cage. The spinal column surrounds and protects the spinal cord, which is central nervous, the energy channel, Sushumna Nadi. It is the axis in which the poses of yoga revolve. All right, so the axial skeleton is this cranium, the skull, the ribs, yes, and the skeleton. I'm sorry, and the spine. So this, and this, the axial. And I like to think of this as your axius, right? Or the axial line. Where is your axis? Yeah, I always like to say head, heart, and hips, right? That check to see as we get deeper into our yoga, the cueing of the yoga poses, the bandhas, right? Where is the head in relationship to the heart? Are you pushing it forward? Is it gently drawing back? Where is the heart in relationship to the hips? Is it pushed forward? Are the shoulders rounded? Or can it neutralize back and the shoulders move down and back as the hips gently settle? Is the pelvic floor, is the pelvis just spilling open? Or is it gently contracting slightly, yet remaining open into the earth as you are aware of the legs and their movement into the mat? So, and the excuse me, I cannot talk today. Appendicular skeleton connects us with the world. So it's all the extremities, appendicular, right? The lowers, the upper, and it holds all of our senses, right? How we touch things, how we walk on the earth, the different textures that we feel. The shoulder girdle and the hip girdle are next, right? The shoulder girdle. A lot of people say it's a very, what is that called? It's a very it's not well guarded, but like the hips. It's a free floating joint. So it has it's a vulnerable joint space, right? We have the scapula, which is the shoulder blade, right? Scapula. And then we have the scapulothoracic joint, the clavicle, the sterno and acroclavicular joints, so the AC joints, and the humerus, and the glenohumeral joint, right? So all of this is the shoulders. You could just kind of touch and see like it's made of one large bone in particular that kind of hooks up to the clavicle, is what kind of connects it into the whole, right? And then we have the pelvic girdle, which is much more stable, right? You have these beautiful the iliac crest is the top of them, right? The iliac bones, the sacral joint. It's that wonderful thing at the bottom of our spine, right? As we have on the spinal cord, the 7 cervical, the 12 thoracics, comes to about almost at the bottom of the ribs. And then we have the lumbar, the 5 lumbar, and then it goes into the sacral. The sacral, there are different joints in there too. The femur, the thigh bone, and the hip joint, right? That is the pelvic girdle. As we continue on, we're going to number 19. So he shows you the vertebral column, the 7 cervical, right? I like to just take your hands and you could place it at the base of your neck, that large protruding bone. Most people have a larger protruding bone. Or if you tilt your head forward, your chin tucks towards your chest, is that big bone, right? As you tuck your chin, it's the pronounced bone that you feel as you place your hands back there. That is C7. And C1, as you take your hands and kind of hold the base of the skull, it's not really palpable. Some people can get to it, but it's kind of tucked in under the hairline, right? C1 is right up here. And it's very, very subtle. You can just kind of hold the base of your hairline with your hands and just kind of do a small little tilt and little nod, just tiny nod. That's where your cervical starts, and the large bone is where the cervical ends, right? The thoracic is from T1, so it's the bone located right under C7, till about right under the rib cage, T12. Lumbar starts right where T12 ends, L1, to the very, very bottom base of the spine. You can usually, again, find where the sacrum ends. You can just feel it. And that is where L5 is. The sacrum is noted that there are larger joints underneath and within the sacrum. And then you have the coccyx, which is the tailbone. right? We determine the spinal curves by viewing them from the side. Kyphosis is a convex curve and lower doses is a concave curve. This illustration demonstrates the four normal curves of the spine. So in cervical spine, I'm going to turn to the side. You want a slight, there is a slight tilt of the neck, right? It's a slight curve of the neck. And then thoracic kyphosis is kind of the same way, where it's not necessarily like this, which is more kyphosis if you develop a hunchback or if you see a large bulging area and from behind the back, it's more of just like a little bit of a curve, right? Lumbar lordosis, which again has an extreme, right? So a slight tilt forward, but not too far, right? Too far forward, where you feel like you're protruding your hips and everything of the contents of your hips and pelvis are just spilling down and out. So cervical can have lordosis, the thoracics can have kyphosis, the lumbar can have lordosis, and the sacral can have kyphosis. And this if one or more of those things are present, scoliosis is usually the next thing that we assume that would be diagnosed. And as you turn to page 20, you can see a great example of scoliosis. And that I know what you're thinking. Well, is yoga applicable to people with scoliosis? Yes, of course. One of a great yoga teacher, Darren Rhodes, has scoliosis, and he was able to work through this and maintain and just achieve amazing yoga postures with just practice, patience, and breath work, right? And he allowed his body to move into the different yoga asanas. Amazing, amazing yogi. So scoliosis is a lateral deviation and a rotation deformity of the spine. The most common form of scoliosis is called idiopathic, meaning without an unidentifiable cause. Other forms include congenital neuromuscular scoliosis. Studies have suggested that idiopathic scoliosis is related to hormone factors, including the level of melatonin, produced. This form of scoliosis also has hereditary component. When the magnitude of the scoliotic curve progresses beyond 20 degrees, there's a risk of continued progression after skeletal maturity. A very large scoliotic curves can impact respiration by restricting the rib cage. Scoliosis also affects the pelvic and the shoulder girdles. For example, the tilting of this pelvic girdle creates a perception of limb length discrepancy. One leg is shorter than the other. Similarly, one arm may appear shorter than the other, and you'll usually see it with this, and then the hips will do the opposite. Okay. Scoliosis affects the bone, the cartilage, and muscles of the spine. Muscles on the concave side of the curve become chronically shortened when compared with those on the convex side. Yoga postures aid to counteract this process by stretching the shortened muscles. And so, and he gives some beautiful recommendations of Shalabhasana, which is a locust, and Mukha Paschimottanasana, one-legged forward bends, a variation of it from the Ashtanga series. And longer postures are recommended, as well as just being patient again. Using yoga, and you can use it throughout the day, not just one time a day or once a week, but throughout your week, throughout your day, as to help settle in to your body, maybe for slumber, maybe just to feel at ease, maybe to set up a little yoga mat as an entrance into the world.